My name is Katie Richards, and I am the president and CEO of Siloam Health.
I'm Caleb Hemmer. I'm District 59 in Southern Davidson County.
I'm Brock Martin, state rep out in West Tennessee. Huntington's where I'm at. I have Gibson, Carroll, and Henderson counties.
Siloam is a faith-based healthcare nonprofit in Nashville. We provide whole-person healthcare for marginalized immigrants and refugees. So in the past year, there was some funding that became available, and we needed some really specific data from a specific zip code that we just could not easily find on Google.
One of the things we wanted to work on in a bipartisan manner was looking at children's mental health. We've seen so much things that have gone on in the news, from books we've read, and we wanted to, and also just being parents, when we wanted to really address that issue and work on bipartisan solutions that will help our communities.
I think one thing we saw in discussion was there is a gap of who was kind of in charge in this situation. So Caleb and I got together, we talked about it, and then we leaned upon Sycamore Institute, kind of being experts in that field, and thought, hey, this could be an avenue to help us address it and find solutions.
Sycamore came alongside and helped us to find the information that we need. We used that in our grant request. We got the money, which we were grateful for, and in turn, there were several hundred people that we were able to provide healthcare for last year because of those funds. And it helped me to realize how incredibly lucky we are in Tennessee to have the Sycamore Institute, to be able to have information that I know is not coming attached to any agenda, that I can trust to help us earn trust with funders. It's incredibly valuable.
Oh, there's many challenges we face. Lack of information is a lot of things. We don't have huge research staff, and when we have an issue like children's mental health we wanted to work on, it was great that Sycamore had already been doing a series on policy initiatives on this subject, so it really helped us get up to speed a lot quicker.
They're kind of experts in that. They really help steer us and give us direction. We now can utilize the resources that they provided to make sure that state governments, all the agencies, start working better together and focusing on what's important, and that's the mental health of those children.
Also like that Sycamore had already reached out to various stakeholders in the field to get their opinion and be part of that working group for the policy. So it really brought a lot of disparate opinions to the table already, which in my opinion helped really speed things along.
What I most appreciate about Sycamore is that they feel like partners in the work that we do. They're highly responsive, they're willing to hop on a call and engage with us, and quite honestly, they're providing us something that we could not afford otherwise. We're not large enough to justify having someone in-house with this kind of skill set. So to be able to have a partner to outsource this to, it is so valuable. Because Sycamore exists, then our staff are able to focus on what they need to be focusing on, which is delivering excellent care to our patients.
I think just the information was invaluable, knowing that we have a group that we can reach out to at any point that are experts in this area, that are doing a lot of research behind the scenes. It gives us as legislators comfort to know that what we're getting is accurate and the most up-to-date information that we can do.
Yeah, I appreciate the thoughtfulness, the thoroughness that goes into these bipartisan solutions and the work that Sycamore does, not only in children's mental health, but education, fiscal reports. It's very good from me as a policymaker to kind of have a second eye, third eye looking at these issues. And so I really value Sycamore's input and work in that regards.
The nonprofit community needs Sycamore, and so Sycamore needs to be supported by the community that can support them.